Hey, how are you? My name is Amy. I'm going to be your student nurse for today. I'm going to go ahead and wash my hands, and I'm going to provide privacy. Could you verify your name and date of birth for me, sir?
Garcia-Autry 2000.
Okay. And I'm just going to verify your doctor's orders, and he's ordered that we do a complete head-to-toe assessment today. And that's just going to include various different body systems, which include your cardio, respiratory. We're also going to be assessing your gait, balance, musculoskeletal, head, ears, eyes, nose, and throat, gastrointestinal. This is going to be a bunch of different systems, okay? All right, so before I begin, I'd like to ask you if you could tell me what year we're in.
2021.
Okay, could you tell me who our current president is?
Divine.
Okay, and could you verify your name and date of birth again for me?
Garcia-Autry
And could you tell me where you are at?
At the hospital.
Okay, so, and do you know what brought you into the hospital today?
Just some pain.
Okay, so just some pain. So I see that our patient is alerted to person, time, place, and situation. So he's alerted ×4. So I'd also like to explain to you that we use what we call a gas flow coma scale to help us determine the status of our patients that are in coma. And it has 3 different categories that they fall into, which include motor response, eye responsiveness, and verbal response. And based on what you score in those 3 categories, we total up your score. And if you have anything less than 8, that's going to indicate severe head trauma. Anything between 13 and 15 means that you have little to no head trauma. Okay. So before I begin my assessment, I'm just assessing you, and I'm seeing that you're have good hygiene, that you're dressed appropriately, and I'm also looking at your hair. And I'm noticing that it is appropriate for your ethnical background. And so the next, I'm just going to go ahead, I'm going to put on my gloves. Okay. And I'm just going to begin by just lightly palpating your hair, okay? And when I'm doing this, I'm going to just be looking to see if there's any lesions or anything. Have you had any recent headaches? You haven't? Okay, so I'm just going to palpate lightly. Okay, and does this cause any pain at all? Okay, so no tenderness or anything. And I'm just going to look at your scalp and inspect. Okay, so your scalp looks fine, and your head is normocephalic. There's no abnormalities noted or anything. So the next, I'm just going to look at your ears to make sure that they line up with the outer corner of your eye. And they both do. And can you hear, I'm going to get you to cover up this ear for me. Can you hear this? Okay, and then cover up this one. Can you hear that? Okay, and have you had any recent ear drainage coming out or anything? Any trouble hearing? Okay, so the next I'm just going to go ahead and move into looking at your eyes, okay? Before I begin, I'm just going to measure your pupil size, okay? Okay, and it's looking about a 6. Okay, so I'm just going to shine the light in this pupil first, okay? And the light that I shine, or the eye that I shine the light in, it should constrict 100%. And then you should see 50% constriction in the opposite eye, okay? Okay, and I see that this one did constrict 100% and that one constricted 50%. Okay, and then this one constricted 100%, this one 50%. I'm going to shine the light one more time so that I can assess your pupil size. Okay, so it went down to about a 3. And then this one also went down to about a 3. So your pupils are both equal, round, reactive to light, and I'm just going to make sure that they're accommodated, okay? So just look at the pen light for me and just follow it for me. Okay, so I'm noticing that your eyes do dilate whenever it moves further away from you, and they constrict when it comes closer, which is normal. So your eyes are both, your pupils are equal, round, reactive to light, and accommodation, okay? So the next, I'm just going to get you to pull your mask down for me. I'm just going to assess your nose and make sure that it is midline, and it is midline. It's going to shine the light, okay? And I am noticing that your nostrils are, they are moist and pink and everything. And then I'm also noticing that you don't have any nasal flaring. So can I get you to cover up this nostril for me? And then just breathe out this one. And then cover this one up. Breathe out this one. Okay? So, did that cause any trouble or anything? Okay, so that is completely normal. And I'm just going to observe your lips, and they're both symmetrical, and I don't see any abnormal discoloring or cyanosis, which is just like blue discoloration of the lips. Your lips are perfectly pink and moist as well. And can I get you to open your mouth? Okay, and I see that your teeth are all intact, and that their mucosa is pink and moist and everything inside, so that looks fine. And have you had a history of nosebleeds or anything? Do you wear contacts or glasses? Okay, and do you have any dentures or anything? You don't? Okay. And have you had any recent cavities or tooth pain? Okay, so you can pull your mask back up if you'd like. Okay, so then next I'm just going to get you to swallow for me, and I'm just going to feel your trachea to make sure that it's midline. And it is. Did that cause any pain at all? It didn't? Okay. So the next I'm just going to put my pen light up, okay? And then I'm just going to assess for your skin elasticity. So I'm just going to pinch the clavicle right here. And then pinch this other one. Okay, and when I'm doing that, I'm assessing your skin turn. I'm making sure that whenever I pull the skin up, it retracts back, and that just indicates that you're well hydrated. And if it did not retract back when it stayed pinched up, that indicates dehydration, but you are perfectly hydrated. And then next, I'd also like to point out that your carotid pulse is here, and then here on the opposite side. And could I get you to lean back just a little bit for me? Okay, and then turn your head that way. Okay, and I'm going to come on this side and then turn your head this way. Okay, so what I'm doing there is that I'm looking for jugular vein distension, which is an indicator of heart problems, but you don't have any JVD, so that means that your heart is healthy. And so then next, I'm just going to go ahead and I'm going to listen to your lung sounds, if that's okay with you. Okay. Could you take a deep breath for me? Okay, and we're going to be in the right upper lobe. Take another deep breath for me. Okay, we're going to be in the left upper lobe. Take a deep breath for me. Okay, and then right there, we're going to be in the left upper lobe still. Take a deep breath for me. Okay, we're going to be in the right middle lobe. Take a deep breath for me. And we're going to be in the right lower lobe. Take another deep breath. And we're in the left lower lobe. Okay. And then I'm going to go ahead and I'm going to listen to your heart, okay? Okay, so we're going to be at the second intercostal space at the aortic valve. I'm going to come right across. We're going to be at the second intercostal space. And we're going to be listening to the pulmonic valve. Come down to the third intercostal space. We're going to be at Erb's point. Down to the fourth intercostal space, and we're going to be at the tricuspid valve, or I'm sorry, the mitral valve. And then at the fifth intercostal space, that's where we're at the tricuspid valve, or mitral valve, I'm sorry. Okay, I'm just going to flip this over. I'm going to listen to the bell to see if I hear any heart murmurs, okay? So we're going to be at the second intercostal space at the aortic. Second intercostal space at the pulmonic. Third at the Erb's point. At the fourth intercostal space at the tricuspid valve. And then at the fifth intercostal space at the mitral valve. And this is also known as the apex of the heart, and this is where we would check for the apical pulse as well. Okay, and have you had any trouble breathing? Okay, any chest tightness or pain? Okay, and I'm just going to get you to turn around this way for me. I'm just going to go ahead and I'm going to listen to your lungs, okay? Okay, and I'm going to start in the right upper lobe. Okay. Then I'm going to move down into the right. Alright, hold on, give me 1 second. I'm going to go back to the right upper lobe. Take a deep breath for me. I'm going to go to the left upper lobe. Take a deep breath for me. Left lower lobe, take a deep breath for me. And then the right lower lobe, take one last deep breath. Okay. So I didn't hear any adventitious sounds while I was listening to your heart or to your lungs in either the quadrants or in any of the valves. And I didn't hear any heart murmurs or anything. And I'd also like to educate you on what we call the cough and deep breathe technique, where you're just going to take a deep breath and then turn around and cough. Okay, and what that helps do is just it's going to expel any mucus that may build up in your lungs so that you don't get like a pulmonary infection or a lung infection. Okay, and then I also like to educate you with an incidence spirometer, which is going to take this, you're going to take a deep breath in, hold it as long as you can, breathe back out, and we're going to try to get the little ball to go up to about 200, okay? Show me how you do that. Okay. So you're going to do your incidence spirometer about 10 times an hour. If you're watching TV, you can do it in between each commercial break, but don't do it back to back. And same thing with the cough and deep breathe. You're going to also do that about 10 times an hour, but you don't want to do it back to back, okay? And next, I'm just going to go ahead and I'm going to assess your skin. And I'm just going to observe if I see any lesions or anything. Have you had any skin dryness lately? Okay, I'm going to palpate with the back of my hand to see the temperature of your skin, and it's warm to touch. Same thing for this side. Okay, and it's warm to touch on this side as well. Does this cause any pain? Okay, I'm just feeling for edema here. Any pain at all? Okay, I'm just checking for edema here. And I notice that the hair distribution on both arms is equal throughout. There's not any spots that don't have any hair or anything. And I'm also don't see any lesions, and his skin color or pigmentation is appropriate for his ethical background. And next, I'm just going to go ahead and I'm going to assess capillary refill, and it should be under 3 seconds. Okay, and that's under 3 seconds. And next, let me just point out, before I point out your brachial pulse, it's going to be your axillary and then your brachial axillary. And then next, I'm just going to check your pulses on both. Okay, they're going to be your radial pulses on your wrist. Okay, and these are both +2, which are normal and expected, and they're bilaterally even. And then next, I'm just going to count your pulse, okay, so I can assess your heart rate. Okay, so your pulse was about 80 beats per minute, which is within the normal range of 60 to 100, and your respirations were 14, which is within the normal range of 12 to 20. And you had even unlabored breathing, which is what we refer to as eupnea. Okay, so then next I'm just going to go ahead and I'm going to get you to flex and extend your elbow, and I'm just going to feel right here, okay? Okay, and I'm just looking to see if I notice any crepitus, which I don't. So I'm going to do the same thing over here. Flex and extend your elbow. Okay, no crepitus noted, and I'm going to get you to flex and extend against resistance for me. Okay, do the same thing on this side. Okay, so there's no crepitus noticed there, and there's just normal range of motion in both of the arms, or both of the elbows. And then next I'm going to get you to flex and then extend and then hyperextend your wrist, okay? Okay, and I do notice a little bit of crepitus there. So go ahead and flexion, extension, and hyperextension for this one as well. Okay, there's a little bit of crepitus there as well. And I'm going to get you to go ahead and push against resistance for me. Okay. And then push against resistance. Okay, so there's normal range of motion in your wrist as well. And then next I'm just going to note that the femoral pulses would be here, and then your popliteal would be here. And could I get you to lay back down for me if you don't mind? I'm just going to go ahead and I'm going to assess your GI, okay? So before I begin listening to the different quadrants, I'm just going to note the contour and symmetry of the abdomen, and I see that his abdomen is flat, and I don't notice any abnormalities or protrusions or distension just by looking. So I'm just going to go ahead and I'm going to start listening to his 4 quadrants, and also notice that his umbilicus is midline and that it's not protruding or anything, and I don't see any drainage in the umbilicus as well. Okay, so I'm just going to start in the right lower quadrant, and I would listen for about a minute. Then I would move up to the right upper quadrant, and I would listen for about a minute. Then I would move over to the left upper quadrant, listen to about a minute. Left lower quadrant, I would listen for a minute. Okay. Then we'll turn our stethoscope around. We will listen with the bell to those same quadrants. So it would be in the left lower quadrant, left upper quadrant, right upper quadrant, and then the right lower quadrant. And then we would want to listen above the umbilicus and below the xiphoid process for any aortic aneurysms, any abdominal aortic aneurysms. Okay, and I don't hear any abdominal aortic aneurysms there. So next I'm just going to lightly palpate these 4 quadrants. Okay, let me know if you feel any pain or discomfort. Any pain at all? Okay. Any pain? No pain at all, right? Okay. And could you tell me when your last bowel movement was?
A couple hours, yeah.
Okay, and was it just a normal solid stool? Okay. And are you passing gas? You are? Okay. And whenever you go and you urinate, is your pee just normal, or does it have a weird color, smell, or anything? Okay, no sediment or blood or anything in the urine? Okay. So I'm just going to get you to go ahead and sit back up for me. Okay. So next we're just going to flex and extend the knee, kind of like how we did your wrist, okay? Okay, we're going to flex and extend this one. Okay, and there's no crepitus noted. And we're going to do the same thing against resistance, okay? Okay, no crepitus noted there, same thing here. Okay, and no crepitus noted there. So then next, I'm just going to assess your capillary refill on your toes, okay? And it should be under 3 seconds as well. Okay, and then next I'm just going to feel for your dorsalis pedis pulse. Same thing over here, dorsalis pedis pulse. And those are both +2 normal and expected pulses. And then I would feel for your post tib. And both of these are going to be +2. Okay, I'm just going to palpate for any edema. Does this cause any pain or anything? Any pain at all? Okay, and I'm just going to roll up your pants leg just a little bit. Okay, and I'm just going to assess for any lesions or anything, and I don't see any lesions. Any lesions on this, and there's no bruising or anything, and his hair distribution is even along his legs. Just going to pull these back down. Okay, so then we're going to go ahead and we're going to do flexion and extension of your ankle, okay? Going to do this one for me. Okay, and I'm going to do against resistance. Okay, and I don't notice any crepitus or anything that cause any pain at all. Okay, and have you had any joint pain or stiffness? You haven't? Okay. So the next, I'm just going to go ahead and I'm going to stand up. And I'm going to get you to stand up as well. Okay. So I'm going to come on this side of you. So I get you to close your eyes for me and stand still with your arms at your side. And we're just going to close our eyes for 20 seconds. I'm going to make sure that you have balance, okay? Okay, so you can open your eyes and you have even balance. You don't have any abnormal swaying or anything. So now I'm just going to observe your gait or how you walk. If you could just walk this way for me. Okay, and then just walk back that way. Alright, so I see that your gait is unswayed. And you can keep your balance without falling over or anything. So if you can go ahead and do what we call heel to toe walking or tandem walking, and just walk heel to toe for me. Okay, and I see that you have perfect gait with no abnormal swaying or anything. You can sit back down. Okay, and so one more thing that we also use, it's another scale that we use to determine how at risk our patients are for developing any pressure ulcers and stuff. And some of those factors within that scale include mobility, activity, and also activity and nutrition. So if you have impaired mobility, activity, or inadequate nutrition, that can put you at a higher risk for falls. Okay, so let me just look over this sheet real quick.